p.m. outside of Washington, D.C. Lloyd, you're even earlier.
Yeah, I'm almost at the 5 a.m. in the Midwest in the U.S., but one of our other colleagues is in Arizona, so still another hour earlier.
Great.
And if anybody joins from the West Coast, you get full credit for commitments.
And of course, we also have folks from Bangladesh where it's already very soon time to go home. Or, yeah, we're already home, most of us anyway, but stop working, I hope. All right, so it's time to start. Welcome, everyone. I know we had a couple people just joining us, so please introduce yourselves in the chat box. Thank you so much for joining us. My name is Maya Person, and I'm the Communications and Knowledge Management Advisor for the IDEAL activity. And I'm here with Lloyd, my colleague from IDEAL.
Hi, everybody. I'm Lloyd Banwart. I am the Monitoring, Evaluation, and Research Advisor for the IDEAL activity. And so welcome to the third showcase in our COVID-19 Data for Decision Making series. So this specific series is focused on Middle East, North Africa, and Asia regions. And we're really excited for the content that we have for you all to listen to and have a conversation around today.
And before we dive in, just a couple things around Zoom. So please keep your microphone on mute when you're not speaking. And if your internet connection allows, we'd love to see your faces. So please turn on your cameras and we'll try to imitate being in a room together as much as possible. And if you have any questions at any point during this event, please feel free to send a message in the chat box to anyone with IDEAL in their name. So there are a few of us here. So just look for IDEAL in the name and shoot us a question.
Thanks, Maya. So a little backstory as to how this Data for Decision Making showcase came about. For the first few months of COVID-19 affecting all of us globally, IDEAL held a number of activities around how M&E practitioners are collecting data and the challenges we had in doing that in a COVID-19 world. But as the pandemic went on and continued to affect us, we spoke with a number of yourselves and your colleagues, and we heard that there was a need or a want to understand how activities were taking the data they're collecting and applying it to their activities, what it meant for their activities, how that data was driving decision making and improving in modifications of their activities. So that was the impetus for this series of showcases, and we wanted to have that represented in regions across the globe. And so this is really an opportunity for programs and activities to share some of the data they've collected and share with the broader community broader food security community what they did with that data. Like, what does it mean? How did they make the modifications? And really at the end of all of this, at the end of all of our showcases, the final one is next month in Latin America and the Caribbean. We really want to have a library that has a plethora of examples from across the globe of how different activities and programs have taken data and informed and modified their programs through evidence-based decision making. So today we're really excited. We have 5 resource persons from across MENA and Asia, and they're going to share their experiences for their activities. And in just a few minutes here, they're each going to take 90 seconds to 2 minutes and give you almost their pitch, their commercial around what the content of their poster is. And then after that, after those brief overviews, we're just going to go into small breakout rooms. So I hope you have your morning coffee, afternoon coffee, and all we're going to ask you to do is sit back, listen, and engage. We really want you to engage with our resource persons from these 5 activities. Ask questions, share your own experience in these breakout rooms. So this activity today for the next 90 minutes is going to be much more intimate, we hope. It's not something for you to just have on in the background as you're walking around the house. We really hope that each of you takes the time to engage and share your own experiences around COVID-19 and data and using data to make decisions. So now I'd like to invite each of our resource persons to start those pitches. Now, I'm just going to pause for a second and make sure that I didn't skip over anything from my colleague Maya.
No, I think you covered it.
All right, great.
Yeah.
All right, so first up from Mercy Corps, Nepal, we're going to have Srishti Karki and Nabin Lamachani, and they will be giving an overview of the activity they're working on in Nepal.
Thank you, Lloyd. Good morning, good afternoon, and good evening, everyone. I am Srishti Karki. I am the MENA manager for Girls Education Program at Mercy Corps, Nepal. And I have with me Mr. Nabin Lamichhani, who's the program manager for Girls Education Program and Youth at Mercy Corps, Nepal. So our project is supporting the education of marginalized girls. It's a DFID-funded project which aims to improve the educational outcome of the girls, increase their access to income-generating activities, and cultivate an enabling environment at their home, school, and community. It is a very holistic project where we not just work with the girls who are going to school and who have dropped out, but we also work very closely with parents, teachers, school management, boys, local cooperatives, vocational schools, and local government. So when COVID hit, the project conducted a series of immediate assessment with 1,254 girls and around 582 stakeholders. The findings from the assessments help the project adapt its activities, focus our efforts to meet the urgent need of the girls through in-kind support, linking with survivor-centric support mechanism, designing informative radio campaigns, increasing their access to water and sanitation, and learning through radios and other online platforms. So in our poster today, we will be talking more about the findings from our COVID assessment and how the project adapted the intervention to meet the immediate need of the girls, respecting their dignity and the impact of these adaptations. Thank you.
Thank you so much, Srishti. I am very much looking forward to hearing more about your poster and program. Next up, we have Saika Kabir, who has a poster from World Vision Bangladesh.
Thanks so much. So hi everybody, I'm Saika, working with World Vision in Bangladesh on the Nabojatra project, which is a 7-year food security, nutrition and resilience project funded by USAID. We're currently in year 6, focusing on sustainability and handover. 2020 was an unprecedented year for all of us. In Bangladesh, Nabojatra, we had to contend with COVID-19, Cyclone Amphan in May, and prolonged flooding in the aftermath of Cyclone Amphan. So these challenges really tested the welfare of the families that we work with. In June and July, we conducted 2 impact assessments to understand the extent to which communities were impacted by these multiple challenges. The data and findings were used to adapt and inform our strategies and approaches, not just in the aftermath of COVID and Amphan and the flooding, but really also informed and strengthened our long-term sustainability approach. Our adaptations include digital SBC, adapting community-based savings, and I look forward to discussing these in details in the breakout rooms. Thank you so much.
Thank you so much as well. And next up, presenting on an activity from CARE in Turkey, we have Ceyhan Alu.
Hello everyone, my name is Ceyhan Alu. I'm representing CARE International in Turkey. And as you all know, CARE has been one of the key actors that contributed to restoring the food security and livelihood opportunities among vulnerable Syrians. As a response to COVID-19, CARE has established a COVID-19 task force and adapted WHO's recommendation to promote the preventive measures against the virus. The spread of COVID-19 in Syria, followed by preventive measures, impacted the supply chains and fluctuated the Syrian pound, which in turn have risen up the food prices and threatened the food security and livelihoods. Accordingly, CARE has promoted women's participation in livelihood activities, created opportunities for safe access to vocational training and cash for work, to produce masks and contribute to scaling up the production of preventive measures. Moreover, CARE has provided awareness-raising sessions for stakeholders in the market. I look forward to participating in the discussion and sharing experience with you all colleagues in order to scale up our adaptive measures. Thank you.
Thanks so much, Ceyhan. And following Ceyhan from Bangladesh as well, representing World Vision, we have Dorrance Cooper and Ryan Balesso.
Good afternoon, good morning, good evening, everyone. I am Dorrance Cooper from the Emergency Food Security Response Program in Bangladesh, in Cox's Bazar. For this presentation, I'll be doing it together with Ryan, the Deputy COP, and I'm the COP for the grant. But the presentation was put together by the team, particularly our M&E team. The Emergency Food Security Program is a 2-year program that started in 2019 and will end in 2021, and is being funded by USAID and BHA. The goal is to improve food security and nutrition for 34,112 Rohingya refugees and 5,229 vulnerable host community. The camp program ran for a year that ended in August 2020, and we've just concluded our evaluation. It's a multi-sectoral approach in the host community that looks at health, nutrition, wash, agriculture, and DRR and gender. And in the camps, we're looking at skills training, working with refugees to also increase their household food security. And when COVID hit us in March, April, we had to go back to the drawing board to make sure that operations continue for these vulnerable people, both in the camp and the host community. The program had to seek a slight modification after our assessment from USAID, and which they granted onto us to do some of the adaptation we'll be talking about in our break room session. And for us to be able to adapt this program, we had to do some quick survey. And when we get into the breakout session, we'll look at the data collection methodology we used in order to be able to adapt to the current situation and to make sure that program goes ahead. And the most affected people, like the refugees, were still able to receive what they wanted to, what they had to receive to make sure they were sustainable. We'll also, when we go to the breakout session, some of the programs that we adapted after our data, we'll look at this data in details that help us to look at how we are going to adapt our programs for the camp and how we are going to adapt our programs for the host community to make sure that we minimize the impact of COVID-19 on both the Rohingya refugee and the host community. We'll also look at in details the reason why we did this adaptation and how this adaptation helped us not only to reach the beneficiaries we're here to serve, but also to protect staff and also to look at virtual method in collecting data that help us to implement the program. So we'll talk more. There will be opportunities to ask questions when we get into the break room sessions. Thank you, everyone.
Thank you so much, Lawrence. And last but far from least, we have Ahmed Lodi from Save the Children discussing the activity he is supporting in Pakistan.
Hello, everyone. Very nice to be joining here with all of you guys. I'm Ahmed Lodi. I'm representing Save the Children, and I work as their meal coordinator for the Pakistan country office. My organization has been working in 120 countries protecting the rights of children. And in Pakistan, we've been ambitiously programming since 1979 in programs on health, nutrition, education, livelihood, and humanitarian response. And also in the current context of the global pandemic, Save the Children is working closely with the government of Pakistan on COVID-19 emergency response. So globally, Save the Children conducted a research on assessing the impact of COVID-19 on children, in which the Pakistan country office naturally conducted its own study, and we came up with findings that we're hoping to share with you today. The research involved about 950 parents and their children, capturing the effect that the pandemic has had on their access to healthcare and education and the impact it had on their income. So the findings allowed us to understand how varying degrees of these access limitations have impacted children's learning process, their access to health and nutrition, and their overall well-being. So we're utilizing the learning from making program adaptations, and some of them I'll just go over quickly, but be hoping to talk to you in more detail about. These adaptations include engaging partners in telemedicine initiatives as alternate access to health, providing wash facilities to promote sanitation practices in the context of COVID, suggesting health safety protocols to educational facilities, ensuring safety of access, and extending psychosocial support to ensure that children and caregivers are kept to the best of their well-being. So looking forward to discussing more of this with you.
Thanks so much, Ahmed. After listening to those five, I am really genuinely excited for the breakouts and to dig into a bit more detail on each of those from our MENA and Asia partners. Before we do that, I'm going to hand over to my colleague Maya to walk us through some of the logistics.
Yes, so thank you so much for those pitches. I'm really excited to hear more in the breakout rooms too. We will all be divided into different breakout rooms. And in there, you'll have a chance to hear more and have discussions with each resource person. You don't need to do anything. You will just be placed in these breakout rooms, and then each resource person, each activity will be moved around to visit each room. So all of you in the event will have a chance to hear from all of the programs. So you don't have to choose, you'll be able to hear from all of them. Yeah, and once you're in the breakout room, feel free to turn on the videos. We won't be so many in each room, so it's nice if we can have cameras on and have a nice discussion. Yeah, I think that's it, unless I missed anything, Lloyd, that you wanted to say before we go.
No, I mean, we will not be coming back together into a large room. So we're actually going to stay in the breakouts, participate in our discussions, and then after the fifth resource person has an opportunity to discuss their poster with all of you, we'll close from the breakout rooms and go forth with our respective Tuesdays. So just to set that stage for everybody. I'm looking forward to it. And so just bear with us for a second while we all get zoomed away to our respective rooms, and we'll see you there.
All right, sounds good.